Now, northern Nigeria alone has accounted for 97% of the diphtheria cases in Nigeria following the disease outbreak, as 8,406 confirmed cases from 114 local government areas in 19 states, including the FCT. The Kano state is said to be a destination for 86% of the cases in the country. To contain the spread, federal government has considered compulsory use of face masks in public places in diphtheria-affected states. Now, at the diphtheria outbreak response press conference in Abuja, the executive director of the National Primary Healthcare Development Agency, Dr. Faisal Shaib, disclosed that 6 northern states, including Kano, Yobe, Katsina, Borno, Kaduna, and Bauchi, account for majority of the cases in the country. He revealed that the country has vaccines at its disposal to fight the disease.
The federal government recognizes the power of vaccines in safeguarding public health, and our response to this outbreak centers around the belief that vaccination is our most formidable weapon. We have 2 vaccines at our disposal: the pentavalent vaccine administered to children aged 6 to 4 years, and the tetanus diphtheria TD vaccine provided to children above 4 years to 14 years. Today, we stand united in the face of a public health challenge that demands our unwavering attention and swift action. Diphtheria, as you have heard earlier, is a preventable disease. It has cast a dark shadow over our communities, particularly impacting our most vulnerable citizens, our beloved children. As we confront this crisis head-on, let me share with you the vital role of vaccination in our battle against this formidable foe. In this ongoing outbreak, you have heard that 19 states and the FCT have been affected, with Kano, Yobe, Katsina, Borno, Kaduna, and Bauchi bearing the brunt, accounting for a staggering 97% of all reported cases. Kano alone carries the weight of over 84% of these cases, making it the epicenter of this outbreak.
Well, also speaking, the Director General of Nigerian Center for Disease Control, Dr. DIPHTHERIA Adetifa, who also doubles as a co-chairman of the task force, reviewed that most of the confirmed cases of diphtheria in the country were unvaccinated against the diphtheria. Now, according to him, 64% are either unvaccinated or partially vaccinated, 11% with unknown vaccination status, while 25% are fully vaccinated against diphtheria. He decried the low number and urged for compliance.
The signs and symptoms of diphtheria include fever, runny nose, sore throat, cough, and red eyes. Of course, there are many other things that can present this way. But it is important that when you see these symptoms, you report to your nearest care provider. Why? Because early diagnosis of diphtheria is closely associated with a good outcome. It means we can make a diagnosis early, we can place you on effective treatment for which is available, and therefore reduce suffering and the likelihood of death. If you have symptoms or signs suggestive of diphtheria, the fever, the cough, sore throat, the red eyes, or you have any patch at the back of your throat or back of your nose, and associated with difficulty in breathing or swallowing, please present very early or promptly to a healthcare facility or designated diphtheria treatment centers. Healthcare workers should please maintain a high index of suspicion and notify their local government area or state disease surveillance officer, or call their state Ministry of Health helpline or the MPHCDA and NCDC toll-free lines to report any suspicion of diphtheria in any patient. I would now personally like to plead with the public and with the press to avoid sharing unverified information from unknown sources. Please only share verified information from official government channels to ensure that we do not further complicate the ongoing outbreak and response by inducing unnecessarily fear, panic, or indeed rejection of intervention by communities that need all the help that they can currently get.